My name is Marlene Warren.
My name is Adriana Ramirez.
I'm a Community Connection Outreach Specialist.
I'm an outreach specialist at Community Connections.
I've always worked in the medical field since I was 18.
I've always kind of worked in the social services field. I started working a little bit with the CPS population. I moved over to alcohol and drugs, and I always kind of danced around people who frequent the emergency room.
I've worked with a lot of different populations, but this is the first time I've worked with some of Fresno's disenfranchised, impoverished, homeless, and I really have found my niche and found what I really like to do, and it's to work with a lot of our people that are impoverished here in Fresno. So I met Fernando. He was an inpatient, and we were asked to see him due to his frequent uses of the emergency room and his frequent admissions.
The first thing that I noticed around him was these eyes, these piercing blue eyes, and I'm thinking, are you sure you're just Mexican? He was like, yeah, a lot of people tell me I have beautiful eyes, and I said, you do. We sat down with him and talked to him and found out that he was just like everybody else. He just had a few problems that he needed help with. He could be look pretty intimidating. He has his face tattooed. He's got all these gang affiliation tattoos all over his body. Anytime anybody's willing to work, that's like a gift.
A lot of people say that they would want me to speak to like youngsters, like troubled teenagers, youth. And you know, I've been asked that in the past before. I would like to do that, you know, help youngsters out. That way they don't follow my footsteps, what I've been through, you know.
I met Jimmy and Kelly. I met Kelly first in the clinic, just to introduce myself because I had been looking for them. I had no idea what they looked like. I just knew there were two names that I needed to find because they were homeless and in need of services.
Adrian and I met them when we were asked to help them find some housing because they were living down at the river.
We tried to meet at the car wash one time, in a random car wash, and they didn't make it, so I was thinking, okay, these people don't want help, maybe this isn't the right program for them.
They didn't show up, so we weren't sure if they were ready for, to accept services. But then we made another appointment with them, and they showed up, and they were absolutely delightful, and they had the greatest outlook, even though they were living at the river bottom. And 110 degrees, and we sat out there for a good hour talking to them in the heat, and they really appreciated it, and they said that we took time to listen to their stories and to hear them out when other people wouldn't. I had been trying to work with Ernest since we started our program in 2009. He used to shake so bad, he would ask you for some money, and he would shake and say, Ernest, it's Marlene, you know, let me help you. And he'd just say, no, I'm okay, sister, I'm okay, I'm okay. He is amazing. He's amazing. He has the biggest heart, and being sober has really changed his life. He has started going back to church. He's mended old relationships with his family, with his son. He's got to meet 3 of his grandchildren and is as happy as can be. He continues to go out to the streets and preach about being sober and how everybody's life can change and that there is hope. And with that attitude, it just kind of puts some fuel into my fire, and I know that there's hope out there for other people in his same predicament. And so when I try to help patients, I always remember him. And if Ernest can do it, anybody can do it. They do call us their angels, and I just, I just tell it like it is, and work with my heart, and let my heart lead me into what I believe would be the, helping them the best I can.
We let them know they can have hope, because if they can't help themselves into wanting a better life, we can't do it for them. But we can, try to show them that they can have hope, that they can change, they can have hope that they will have a warm bed to sleep in at night.
Sometimes it turns out really great, and sometimes, patients aren't willing. ready for the change, but I don't think we're angels, but we try our best.